Thank you, Mr. Sherman. We will now move to questions, and I yield myself 5 minutes. And just before that, in accordance with Committee Rule 5E, I ask unanimous consent that Representative Moylan from Guam be permitted to participate in today's subcommittee hearing. Without objection, so ordered. Mr. Case, the VA Inspector General has published 3 different reports about concerns with the clinical care veterans receive at the Hampton VA in my district. Each report highlights the importance of having quality assurance processes in place. If these are not in place, patients bear the consequences. Can you tell me your opinion about why it's important for leaders to have quality measures in place for patient care, and can you also give us some examples of these quality measures?
Chairwoman Kiggans, we have published those reports, and the whole goal is to put the veteran first there. Quality assurance and important quality measures have to be in place. Adherence to defined processes and objective assessments of basic patient safety activities is critical. Leaders must be proactive in monitoring compliance and tracking and trending compliance so that with these foundational requirements. They then have to intervene, modify, or enhance resources in real time to keep patients safe if they see problems and there's constant monitoring. Example, and the best example is from Hampton, is there were ineffective monitoring of the processes to address substandard care by a surgeon. And by doing that, you allow a surgeon to stay in place who is believed to be not operating at the highest level or even at an acceptable level. And so by monitoring those processes, paying attention, demanding accountability, you ensure safety and patient safety.
So the IG also published a report that showed severe mismanagement in veterans' oncology care, resulting in serious delays, which is unacceptable. So how can leaders be proactive in their oversight and involvement in patient care? And you talked about, hands-on and just managing that care, but can you give me specific examples? Is this reviewing charts? Is this, periodic reviews with small groups? Just a little more specific.
Yes, as a general matter, trust is critical between leaders and staff, but verification of performance and adherence to policy and standards is absolutely necessary. The stakes are too high and the data is too readily available to assume patients are getting the care they need, especially those at high risk. And the best example that comes to mind is in Buffalo, where there was the chief of oncology, the staff oncologist were demanding that a patient get an appointment scheduled in the community. The response from others was, we're taking care of it, we'll get it done. But it wasn't getting done. And so that's an instance where you can trust, but you have to verify. You have to intervene and make sure that that patient is getting the care he needs, especially incumbent upon facility management, the staff oncologist, and the oncologist.
Which takes manpower, and then also people who are very thorough and attention to detail in doing those parts of follow-up for their jobs, which I can appreciate. Thank you, Mr. Case. And Mr. Radway, from your experience in the last 4 years, what has OAWP identified as repeat areas of concern across the VA and patient care?
So we haven't, Congressman, really focused on patient care issues per se. We really looked more at misconduct. We have seen several cases where there was a failure to oversee providers who were alleged to have committed misconduct in terms of patient care and improperly treated patients. And then we'll look at the activities of those senior leaders who failed to oversee their providers, their chiefs of surgery, things like that.
And the office, and Ms. Radway again, the Office of Medical Inspector is responsible for assessing VA's quality of care. How do the recommendations made in the OMI reports work to mitigate repeated errors in the care provided in the VA?
I think Dr. Upton, do you want to?
Sure, I'd be happy to take that, Madam Chairwoman. So the OMI recommendations come to both the leaders of the facilities as well as to our senior leaders in VHA. And they, as was mentioned earlier, look at important quality and safety issues within our system, often charged by the Undersecretary for Health or others. And the OMI specifically, makes sure that those recommendations are followed through, and we take them very seriously as part of our commitment to quality.
So you follow up at each facility individually? Is that?
We review them as leaders, as a senior leadership team, and they also work with each facility because many of these are very facility-specific. But we certainly try to take lessons learned across the system as well.
Very good, thank you. Let's see, and then we will now, we will now move to questions from the ranking members. So Ranking Member Ramirez, you are recognized for 5